Hi, everyone. This is Nurse Anna from nursestudy.net, and here are 25 questions with answers and rationales for congenital heart defects. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 6-month-old infant is admitted with cyanosis and diagnosed with Tetralogy of Fallot. The nurse notes that the child often squats after becoming short of breath during feeding. What is the primary reason for the infant's squatting behavior? A. The infant is attempting to relieve abdominal pressure. B. Squatting increases blood return to the heart. C. Squatting decreases the heart rate to improve oxygenation. D. The infant squats to relieve pain. Answer. B. Squatting increases blood return to the heart. Rationale. Squatting in infants with Tetralogy of Fallot increases systemic vascular resistance, which helps reduce right-to-left shunting of blood through the heart and improves oxygenation. This behavior is an adaptive response to hypoxemia. Question 2. A nurse is caring for a 3-year-old child diagnosed with a ventricular septal defect, VSD. During assessment, the nurse notes a harsh holosystolic murmur at the lower left sternal border. What is the most likely explanation for this finding? A. Increased pulmonary blood flow. B. Right ventricular hypertrophy. C. Decreased oxygen saturation. D. Left atrial enlargement. Answer. A. Increased pulmonary blood flow. Rationale. A ventricular septal defect allows blood to flow from the left ventricle to the right ventricle, leading to increased pulmonary blood flow. The harsh holosystolic murmur is caused by the turbulence of blood flow through the defect. Question 3. An infant is diagnosed with coarctation of the aorta. The nurse expects which of the following findings during the assessment? A. Bounding femoral pulses. B. Lower blood pressure in the upper extremities. C. Diminished pulses in the lower extremities. D. Equal pulses in both upper and lower extremities. Answer. C. Diminished pulses in the lower extremities. Rationale. Coarctation of the aorta is characterized by a narrowing of the aorta, typically after the origin of the subclavian arteries. This results in decreased blood flow to the lower extremities, leading to diminished pulses and lower blood pressure in the legs compared to the arms. Question 4. A newborn is diagnosed with transposition of the great arteries, TGA. What intervention does the nurse anticipate as the priority before surgical correction? A. Administration of diuretics. B. Prostaglandin infusion. C. Immediate intubation. D. Antibiotic prophylaxis. Answer. B. Prostaglandin infusion. Rationale. In newborns with transposition of the great arteries, maintaining the patency of the ductus arteriosus is critical to allow for mixing of oxygenated and deoxygenated blood. Prostaglandin E1 is administered to keep the ductus arteriosus open until surgical correction can be performed. Question 5. A nurse is caring for a 2-year-old with a history of patent ductus arteriosus, PDA, who is scheduled for surgical closure. The nurse understands that the main goal of the surgery is to A. Decrease cyanotic episodes. B. Prevent left-to-right shunting of blood. C. Improve right ventricular function. D. Reduce the risk of arrhythmias. Answer. B. Prevent left-to-right shunting of blood. Rationale. Patent ductus arteriosus, PDA, causes abnormal communication between the aorta and pulmonary artery, leading to left-to-right shunting of blood. Surgical closure prevents this shunting and reduces the risk of pulmonary hypertension and heart failure. Question 6. A nurse is assessing a 5-year-old child with a history of atrial septal defect, ASD. The child is at risk for developing which long-term complication? A. Pulmonary embolism. B. Stroke. C. Ventricular hypertrophy. D. Pulmonary hypertension. Answer: D. Pulmonary hypertension. Rationale: atrial septal defect, ASD, leads to increased blood flow to the lungs, which over time can result in pulmonary hypertension. This complication arises from increased pressure in the pulmonary arteries due to the left-to-right shunt. Question 7. An infant with hypoplastic left heart syndrome is being evaluated for surgical intervention. What is the priority nursing assessment before the procedure? A. Monitoring for signs of sepsis. B. Assessment of liver function. C. Evaluating oxygen saturation levels. D. Monitoring for signs of congestive heart failure. Answer: C. Evaluating oxygen saturation levels. Rationale: in infants with hypoplastic left heart syndrome, the left side of the heart is underdeveloped, leading to decreased systemic perfusion. Evaluating oxygen saturation is critical as these patients often have low oxygen levels, and maintaining adequate oxygenation is a priority before surgical intervention. Question 8. A 3-month-old with Truncus arteriosus is scheduled for surgical repair. What condition is this infant at highest risk for developing if left untreated? A. Severe mitral regurgitation. B. Pulmonary hypertension. C. Systemic hypertension. D. Aortic stenosis. Answer: B. Pulmonary hypertension. Rationale: Truncus arteriosus involves a single arterial trunk arising from the heart, supplying both the systemic and pulmonary circulations. This results in increased blood flow to the lungs, leading to the development of pulmonary hypertension if not corrected surgically. Question 9. A nurse is educating the parents of a child with Tetralogy of Fallot about potential complications. Which of the following should the nurse emphasize as a sign of an emergency? A. Frequent crying. B. Increased activity level. C. Sudden episodes of deep cyanosis. D. Decreased appetite. Answer: C. Sudden episodes of deep cyanosis. Rationale: blue spells or TET spells are episodes of severe cyanosis due to decreased oxygen in children with Tetralogy of Fallot. These episodes require immediate intervention to prevent hypoxic brain injury and other complications. Question 10. A 4-year-old with an unrepaired atrioventricular septal defect, AVSD, presents with frequent respiratory infections and poor growth. The nurse anticipates which of the following management strategies? A. Diuretic therapy and increased calorie intake. B. Long-term antibiotic therapy. C. Antihypertensive medication. D. Immediate intubation and mechanical ventilation. Answer: A. Diuretic therapy and increased calorie intake. Rationale: children with unrepaired AVSD often have congestive heart failure symptoms due to the large left-to-right shunt, leading to poor growth and frequent respiratory infections. Diuretics reduce fluid overload, and increased calorie intake supports growth. Question 11. A nurse is caring for an infant with tricuspid atresia who is awaiting surgical correction. The nurse anticipates that the child will require which of the following medications to help maintain oxygenation until surgery? A. Indomethacin. B. Prostaglandin E1. C. Beta blockers. D. Digoxin. Answer: B. Prostaglandin E1. Rationale: in tricuspid atresia, the absence of a tricuspid valve leads to poor mixing of oxygenated and deoxygenated blood. Prostaglandin E1 is administered to keep the ductus arteriosus open, allowing for adequate blood flow to the lungs until surgery can be performed. Question 12. A nurse is caring for a newborn with total anomalous pulmonary venous return. Which findings should the nurse prioritize when monitoring this patient? A. Tachypnea and cyanosis. B. Bradycardia and low blood pressure. C. Hypertension and bradycardia. D. Hyperglycemia and diaphoresis. Answer: A. Tachypnea and cyanosis. Rationale: total anomalous pulmonary venous return is a defect where the pulmonary veins do not connect normally to the left atrium. This results in poor oxygenation, and signs such as tachypnea and cyanosis indicate inadequate pulmonary circulation, requiring immediate attention. Question 13. A nurse is assessing a 4-year-old child diagnosed with an unrepaired atrial septal defect, AVSD. Which assessment finding would indicate a complication associated with this condition? A. Lower extremity edema. B. Decreased lung sounds. C. Jugular venous distension. D. Diminished peripheral pulses. Answer: C. Jugular venous distension. Rationale: an atrial septal defect leads to increased blood flow to the right side of the heart, which can cause right-sided heart failure over time. Jugular venous distension is a sign of increased right atrial pressure and right-sided heart failure. Question 14. A nurse is caring for a 2-month-old with a diagnosis of hypoplastic left heart syndrome. Which of the following symptoms should prompt the nurse to contact the healthcare provider immediately? A. Persistent cough. B. Feeding intolerance and irritability. C. Oxygen saturation at 95%. D. Systolic ejection murmur. Answer: B. Feeding intolerance and irritability. Rationale: feeding intolerance and irritability in an infant with hypoplastic left heart syndrome can indicate worsening heart failure or inadequate systemic perfusion. These symptoms warrant immediate evaluation by the healthcare provider. Question 15. A nurse is educating the parents of a child who is scheduled for surgical correction of a large patent ductus arteriosus, PDA. The nurse explains that if left untreated, a large PDA can result in A. Pulmonary hypertension and heart failure. B. Aortic stenosis and cyanosis. C. Mitral valve prolapse and arrhythmias. D. Right-to-left shunting of blood. Answer: A. Pulmonary hypertension and heart failure. Rationale: a large patent ductus arteriosus, PDA, leads to significant left-to-right shunting of blood, increasing pulmonary blood flow. Over time, this can cause pulmonary hypertension and heart failure due to increased pressure on the lungs and heart. Question 16. A nurse is assessing a newborn diagnosed with Truncus arteriosus. Which clinical manifestation would the nurse expect to find during the initial assessment? A. Cyanosis that worsens with crying. B. Low heart rate. C. Hypertension in the upper extremities. D. Pallor and hypotension. Answer: A. Cyanosis that worsens with crying. Rationale: Truncus arteriosus involves a single arterial vessel supplying both systemic and pulmonary circulations. This defect results in mixing of oxygenated and deoxygenated blood, leading to cyanosis that may become more pronounced during crying due to increased oxygen demand. Question 17. A 5-year-old with Tetralogy of Fallot is experiencing a hypercyanotic TET spell while playing. What is the nurse's immediate priority action? A. Administer oxygen. B. Place the child in a knee-chest position. C. Provide intravenous fluids. D. Notify the healthcare provider. Answer: B. Place the child in a knee-chest position. Rationale: the knee-chest position increases systemic vascular resistance, which helps reduce the right-to-left shunting of blood in Tetralogy of Fallot, improving oxygenation during a hypercyanotic spell. Question 18. A nurse is caring for an infant diagnosed with pulmonary atresia. Which of the following nursing interventions is a priority for this patient before surgical repair? A. Administering diuretics. B. Monitoring for arrhythmias. C. Maintaining patency of the ductus arteriosus. D. Monitoring for hyperglycemia. Answer: C. Maintaining patency of the ductus arteriosus. Rationale: in pulmonary atresia, the absence of the pulmonary valve means that blood cannot flow from the right ventricle to the lungs. Maintaining the ductus arteriosus with prostaglandin E1 is essential to ensure blood flow to the lungs until surgical repair can be done. Question 19. A 6-week-old infant is diagnosed with a large ventricular septal defect, VSD, and is exhibiting signs of heart failure. What should the nurse anticipate in terms of medical management? A. Administration of diuretics and digoxin. B. Prophylactic antibiotic therapy. C. Administration of antiarrhythmic medications. D. Immediate mechanical ventilation. Answer: A. Administration of diuretics and digoxin. Rationale: in infants with large ventricular septal defects, VSD, heart failure can occur due to increased pulmonary blood flow. Diuretics help reduce fluid overload, and digoxin improves cardiac contractility and reduces symptoms of heart failure. Question 20. A newborn is diagnosed with double outlet right ventricle. Which of the following interventions should the nurse anticipate prior to corrective surgery? A. Administration of prostaglandin to maintain ductal patency. B. Intubation and mechanical ventilation. C. Initiation of antihypertensive therapy. D. Initiation of long-term diuretic therapy. Answer: A. Administration of prostaglandin to maintain ductal patency. Rationale: double outlet right ventricle is a congenital heart defect in which both the aorta and pulmonary artery arise from the right ventricle. Prostaglandin is administered to maintain ductal patency, allowing for better oxygenation until surgery. Question 21. A child with a repaired coarctation of the aorta is being monitored for complications post-surgery. The nurse knows that which of the following is a potential postoperative complication? A. Arrhythmias. B. Rebound hypertension. C. Hypotension in the upper extremities. D. Decreased urinary output. Answer: B. Rebound hypertension. Rationale: after surgical repair of coarctation of the aorta, patients are at risk for rebound hypertension as the body adjusts to the corrected blood flow. This requires close monitoring and potential antihypertensive therapy. Question 22. A nurse is caring for an infant with Ebstein's anomaly. The nurse anticipates which of the following interventions will be required prior to surgical correction. A. Administration of anticoagulants. B. Management of cyanosis with oxygen therapy. C. Use of beta blockers to control arrhythmias. D. Keeping the ductus arteriosus open with prostaglandins. Answer: D. Keeping the ductus arteriosus open with prostaglandins. Rationale: Ebstein's anomaly is a congenital heart defect where the tricuspid valve is malformed, often leading to cyanosis. Keeping the ductus arteriosus open with prostaglandins helps maintain adequate oxygenation until surgery. Question 23. A 3-year-old with an unrepaired ventricular septal defect, VSD, presents with frequent respiratory infections. The nurse understands that the underlying cause of these infections is likely due to A. Immunosuppression caused by VSD. B. Increased pulmonary blood flow. C. Decreased cardiac output. D. Airway obstruction. Answer: B. Increased pulmonary blood flow. Rationale: an unrepaired VSD allows blood to flow from the left ventricle into the right ventricle, increasing pulmonary blood flow. This leads to pulmonary congestion and increases the risk of respiratory infections. Question 24. A nurse is preparing to care for a newborn with a diagnosis of dextrotransposition of the great arteries. The nurse knows that, until surgical correction, the most important intervention is to A. Monitor for signs of systemic embolism. B. Keep the ductus arteriosus open. C. Administer antiarrhythmic medication. D. Initiate fluid restriction. Answer: B. Keep the ductus arteriosus open. Rationale: in dextrotransposition of the great arteries, the aorta and pulmonary artery are transposed, leading to poor oxygenation. Keeping the ductus arteriosus open with prostaglandins allows for oxygenated and deoxygenated blood to mix until corrective surgery. Question 25. A nurse is caring for a newborn with a diagnosis of Truncus arteriosus. What complication is the infant at high risk for if surgical intervention is delayed? A. Right ventricular hypertrophy. B. Left atrial enlargement. C. Pulmonary vascular obstructive disease. D. Aortic stenosis. Answer: C. Pulmonary vascular obstructive disease. Rationale: Truncus arteriosus results in increased pulmonary blood flow, which can lead to pulmonary vascular obstructive disease, pulmonary hypertension, if not corrected in a timely manner. This condition can permanently damage the pulmonary vasculature.